This is a holistic approach to transplantation, so that you have this unit which has its surgeons, it has its transplant nephrologists, it has a robust nephrology service that can cater to these patients, that can do the workups, and then look after these patients after the surgery is done. And the other good thing about RMI is that the other relevant specialties like cardiology, pulmonology, interventional radiology, they're all available. You don't have to struggle to get somebody to come and get a cardiology opinion, for example, on some patient, whether pre or post-op. They're all available 24/7. I'm a US-trained transplant surgeon. I trained in the University of Miami in 1998, and since then I've had experience over 25 years in kidney transplantation in the US, in the UK, in Saudi Arabia and Pakistan. So I came here in 2018 October to start this program, backed by an experience of over 1,000 kidney transplants that I had done, both living and deceased donors. We tend to cater to all types of patients, both adult and pediatric. We've operated from people for patients who were like 2 years old to the eldest that I did in Saudi Arabia was 75 years old. So it's not the chronological age, it's how fit the patient is. You may be 40 and may be very unfit, and you may be 75 and maybe a good 75, and so that it all depends. That's why we do this exhaustive workup or the comprehensive workup to determine how feasible the surgery is going to be. We do diabetics, we do patients who've had hepatitis, people with calcified vessels, and also the kidney is not implantable in the normal situation. We've also used more proximal vessels to put the kidney within the abdomen and connect it to bigger vessels, because the other vessels in the normal situation are not available. Either they're diseased or they've been thrombosed because of presence of catheters, or maybe they're calcified, meaning that the spectrum of patients that we can deal with is wide. We don't turn down anybody. We do all kinds of surgery, and whatever suits the patient, tailor the surgery to the needs of the patient, basically. I think you would want to come to RMI because, it's not just words, actually. We back all this, whatever I'm saying, I can back that up with my data. Our outcomes are like graft and patient survival over 95%. So I think that meets all international standards. The other thing is that being a comprehensive unit, we take care of this patient forever. I mean, this is our patient forever. We take responsibility. We make sure that the patient, the post-op care is carried out the way it should. And then after discharge, the patient is again followed up to make sure that the drug levels are adequate and appropriate. And that if there is any issue that develops, there is a plan in place to deal with it. So we take ownership of the patient. So I think that's something that is vital if you want to have a good transplant outcome. If you are considering traveling to Pakistan and having a transplant, I think your basic requirement is going to be that you need an ABO-compatible donor that you need to bring with you. And the other thing that will be required is a workup for both the donor and the recipient, and that is to make sure that the procedure is going to be beneficial to you. We weigh the risks and the benefits, and then we counsel you and will decide whether it's good for you or not. Increasing numbers and our success, we have started the first of its kind transplant surgery fellowship in kidney transplantation. We have 2 fellows now, and they spend time rotating between donor and recipient surgery, and they are getting very good experience. And this is good for the program and for the legacy of this program. That for the first time that you have a place in Pakistan where you can get training like the training that I got. It's the same. I've mirrored the same thing, and I'm duplicating that to make sure that I give something back to Pakistan, and to the young doctors who are aspiring to become transplant surgeons.